Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. One of the most underrated communication skills in clinical encounters is what you say during the physical exam. Because once the exam starts, a lot of students go completely silent, or they think, do I need to explain everything I'm doing? And that uncertainty can make the interaction feel awkward, disconnected, or less professional than it actually is. So today, we'll work on fixing that. So most students are focused on performing the exam correctly, but forget about communicating while they do it. So what happens? Long periods of silence, sudden movements without explanation, or inconsistent communication. And even if your exam technique is solid, it just doesn't feel smooth to the patient. So this is where the Connect framework continues to guide us. At this stage of the encounter, you're actively examining the patient, so your communication shifts slightly. Now, we're going to focus on navigating, ease, and confirm. This helps you stay clear, reassuring, and connected throughout the exam. So let's simplify this into a teachable approach that you can use during any exam. Step 1 is to navigate. This is where you're going to briefly describe what you're doing. So as you move between exam steps, you give a short, clear explanation. For example, I'm going to listen to your heart now. Next, I'm going to press on your abdomen. I'm going to check your reflexes. These are great because they prevent surprises, keeps the patient informed, and maintains flow. Step 2 is ease. We want to prepare for sensations or any discomfort. Before anything that might feel uncomfortable, you want to give the patient a heads up. You could say, you may feel some pressure here, or this might be a little uncomfortable. Let me know if anything is painful. This step is huge for patient comfort. Step 3 is where we want to keep it simple and don't over-explain. This is where many students, myself included, overcorrect. You don't need to explain the anatomy, the physiology, or your full reasoning. You just want to keep it short, clear, step-focused. You want to think narration, not lecture. Step 4 is where we confirm when needed. If something might cause discomfort or requires cooperation, check in with the patient. You could say, is that okay? Are you doing all right? This also reinforces patient-centered care. Okay, so let's put it all together and hear how this might sound in a more realistic flow. I'm going to listen to your heart now, so just breathe naturally as I place my stethoscope on your chest. Next, I'm going to listen to your lungs. Every time you feel my stethoscope on your back, please take in a deep breath and out. Now, I'm going to press on your abdomen. You may feel some pressure. Nothing should be painful, so please let me know if it is. So notice in that flow, there was no silence, no confusion, no over-explaining. We're just using navigate, ease, and simple communication. Let's review 3 common mistakes so you can hopefully avoid them. Number 1 is staying completely silent. This can make the patient feel unsure or uncomfortable. Number 2 is over-explaining every step. This just slows you down and breaks up the flow. And mistake 3 is not warning before discomfort. This can catch patients off guard and reduce trust. So if we tie all this together into an OSCE performance scenario, this can be one of those subtle skills that separates average from really strong performances because it shows the examiner and the patient professionalism, awareness, and patient-centered communication. And it makes your exam feel smooth, organized, and intentional, which aligns directly with the OSCE scoring expectations. If you remember one thing from this episode, I hope it's this. Say what you're doing, give the patient a second to process before you jump in, of course, obtain consent, and warn if it might be uncomfortable. That's it. Short, repeatable, and effective. If this helped you feel more confident during the exam portion itself, that's great, because you're building a skill that patients and examiners will notice. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening, and keep practicing. You got this, future doc.